connection. The echo is coming back.
It's coming back? Wow.
Yes.
Let me see.
You are finished talking and I'm still listening.
Is it better from your end now?
Okay. First and foremost, who is a public health nurse? Yes, a public health nurse is a nurse whose main focus. Yes, it is better. Thank you. A public health nurse is a nurse whose focus is mainly on prevention of illness, injury, and disability, and promotion of health and safety and maintenance of health of the individual and the population at large is their main focus. So, what do we mean by grassroots? In a simple English, it simply means the people at the local level. So, in what capacity can now a public nurse now function? So, as a public health nurse, public health can function in different capacities. They can function as a leader. When I'm talking about as a leader, they champion the campaign so that information can actually reach people at the grassroots level. So when they lead these campaigns in that capacity, also they can function as an educator. The major tool of the public health nurse is health. The major tool is health because they are on the preventive level of the Ministry of the Health. So their major tool is health talk. So they serve as an educator. And the sense that they educate the masses. The health education even starts on their various individual homes. From our homes, we give health talk to our immediate family. In our neighborhood, we give health talk. At our various places of worship, the church, the mosque, the public health nurse is expected to also give health talk at that various end. Then we give it in our neighborhood, maybe in our landlord association community. We give it at our various places in our community. So they serve as an educator. They also educate their co-workers at work, their junior colleagues, their junior nurses at work. So they serve as giving this health talk. Also, they can also serve as an advocate. They can serve as an advocate at different levels. They advocate with the local government, the state government, federal government. They serve as an advocate. Yeah, they can also work. They can also liaise with some NGOs, and serve as an advocate. They serve as a mouthpiece for that grassroots. They are the ones that are very close to them. They know what they actually need. They know how they can actually get to them. And so when they work with these NGOs, they are able to reach people at the grassroots level. Also, they serve as a researcher. As a public health nurse, they serve as a researcher in the sense that they want to know how, when, where, and what they can. So, when you're serving as a researcher, they want to know how have we been doing things. How can we do it better to achieve better results? At that point in time, they are serving as a researcher. Let's take an instance like maybe there is an outbreak of a foodborne disease. They want to know, is it that the food hygiene is not enough, or maybe the food is being contaminated when they are preparing it? Is it where they are sourcing it? Is it where they are preparing the food? So these are things that they want to look into. Okay, we have been doing this way. Let's do it the other way around. Okay, when we are talking about this, let's not take it in relation to the topic at hand, that is this pandemic. Okay, as a researcher, as a public health nurse functioning as a researcher at that end, they want to say, okay, fine, why are people not really complying? Why are people not wearing the face mask? Is it that it's not convenient? Okay, why are people not using sanitizer? Is it because they believe that, there's still some people that believe because of the alcohol content of the hand sanitizer, they tend to avoid it. So it is all the work of the public health nurse to disabuse this kind of misconceptions. Yeah, they want to, okay, fine, this is why people are not hand sanitizer. It's because they believe it contains alcohol. Okay, fine, let us now address this issue. They liaise with the religious leaders. Okay, fine. Is it because this percentage of alcohol is present inside the hand sanitizer? Is it truly under your religion? Is it truly not to be used? So fine, if they are not convinced that, okay, fine, the minimum amount of that alcohol inside hand sanitizer does not negate their act of worship. Okay, fine. then the public health nurse has already performed a research role in that function. They are able to see why that thing is not being used. You understand? Okay, fine. The hand sanitizer that is not being used, is it because it's expensive? Okay, fine. If it is because it's expensive, okay, fine. Is there a way we can produce this hand sanitizer with the locally available resources we have in our environment? Okay, fine. We can actually make use of methylated spirits, add this and this in an hygienic condition, and we can have our hand sanitizer. You understand? So these are things the health workers we do and put in place while functioning as a researcher. Also, they can also function as a policy maker. When I say policy maker, they work hand in hand with the government, either at the local government level, at the state level. They work to develop different policies. They can put different policies in place so that people can actually comply with what is necessary for us at this pandemic period. So
thank you. Thank you very much for that beautiful answer. That will lead me to the next question, which is about that you've highlighted a lot of roles and a lot of functions the public health nurse can take in this situation. And now the next question will now be, what about the people at the grassroots level? How can they access this information due to the fact of the geographical composition of structured and the economic implication as well? Even if the nurses, the public health nurses are ready to go into all this, what about the people at the grassroots level? How accessible are they to all this information? Even, for instance, like the program we are doing via the Facebook, I know a lot of villages, they still have the problem of internet. So, and if the government, the Minister for Health is saying that there will be a great regret if we do not comply with this, what about people at the grassroots level? How do they have this information? How do they have access to the information?
Okay, how accessible are the Nigerians to this information we are talking about? Okay, on a scale of 10, I would say 6. They are fairly accessible. And the Northerners are more accessible. In my own opinion, I think the Northerners are more accessible. Perhaps because of their love for transmission radio, you understand? A typical Hausa man and Fulani man, they are always with their radios. So, and most of their own programs on their radio station is being aired with their indigenous language. Information.
Tantamount to making using it. Having the information does not tantamount to actually believing it and utilizing it. So I think they tend to have access to more information compared to people on the southwestern part of Nigeria and the eastern people on the eastern part of Nigeria. But at the same time, there are so many things that can hinder accessibility of this information. Just like you have mentioned, internet facility is one of it. Then transportation system. We have so many people that wants to go to the rural areas to go and give them information, give health talks about this pandemic, but the road networking could serve as an hindrance. Then the infrastructures in that rural area too is one of those things that have been discouraging health workers sticking to their posting in the rural areas. We always see our health workers when they are posted to the rural area, they always want to come back to the urban to come and work. So if government can also provide some incentives to encourage health workers, maybe they will increase the rural allowance, they can actually ginger people to stay in their workplace in the rural area. Or perhaps they should ensure that they are actually employing people that are more indigenous in their areas into the health facility over there. So those things can actually make things to be more, those things can actually make people at the grassroots to have access to these health talks. Also, there are some attitudes, some socio-cultural beliefs, ignorance. Those things are some of those things too that actually hinder people's accessibility to those information. But notwithstanding, I think government is still doing better, but there's still room for improvement. They have been using the SMS, they have been using some other platforms, So they can still, at least they can still work more on those. That's, they can reach larger population with that.
Thank you. I recently, or let me just say a few hours before this broadcast, I saw a message about the celebration of the annual festival that usually take place in Osun State, I mean Oshogbo to be specific. I'm talking about the Osun Oshogbo. And I was worried, I was so disturbed, I was perturbed, I was, because I saw a lot, I don't know, image, the video I saw, I can't really say how much people attended the program, even though the person that shared it said there were no, the number of people that attended the event were not as more as what usually happen in Indonesia. But what I saw on the video shows exactly what the minister has just said. People are not complying. There was no social distancing. There was no facial mask. People were touching one another and they were celebrating. I don't know. I thought the government put an embargo on the number of together at a point. Very big worrisome to the policymaker. And that will now take me to the next question, that even at that what happened presently as at this afternoon in Oshogbo, in Osun State, where people were celebrating the Oshogbo. Nobody is saying nobody should not do whatever festival that is doing, but the health workers now, especially in this kind of scenario, how can the Nigerian nurses, or what methods can they adopt in rural areas so that people will be well informed about that?
Yes, I think we can do better. We can do better by also working in line, work with the religious leaders. Hello, can you hear me?
Yes.
Can you? Yes. Okay. So
go on, please.
In their own capacity, they have been putting in their best, but we can still do better. Yes, there's still room for improvement. We can utilize different means in soliciting the grassroots people's support. There are some people we just have to bring into the picture, like the religious leaders. They are very, very, very important when we are talking. People tend to comply with anything we hear from our imams, our scholars, our pastors. People tend to follow their instructions better off than even what the government is preaching. So we need to bring in the culture, the community leaders, the village heads. The village heads are also very important. The chiefs, they are also very important. Then the stakeholders. There are some significant others in our society that people respect, probably because they are philanthropists, probably because of the role they play in that community. People tend to respect them. So we need to bring them into the picture. We need to also work with some union leaders. NURCW is a very strong union leader we need to work with. You understand? So you need to bring them into the picture. Women association, they have their own leaders too. So we can bring in their heads. We can also bring in all those various artisans, the fashion designers, the barbing associations, all those leaders. We can also bring them into the picture and educate them, convince them why they apply with this. So when they have already won their hearts, they will now go back to their own people. They will now preach the gospel. They have already passed on the baton to them. So they will continue preaching the gospel to them. And with that, we are soliciting the help of those, we are soliciting their support. And all of them, when you have already gotten the support of the leaders, they go back to their own various institutions, their own communities. They preach the gospel to them. This is what is on ground. This thing is real. It is not a scam. It is not fake. It is not only affecting the rich. It can affect everybody. You have already won their heart. You have given figures. You understand? You are not being discreet about the information. You're giving them all the facts and figures. And when they are convinced enough, they will now go back to their own various places. If it is their church, if it is their mosque, if it is their association, they will go back and preach the gospel to them. You understand? It is true. I saw this thing. It's not too much. You can even take them on visitation. I mean, you can also give them maybe some slides. When you are bringing them into the picture, when you are giving them this stuff, you can bring in some visual aids. Let them see the pictures of people that are affected, how they are in so much pain. You understand? When they see things, when we see with our eyes, we don't forget easily. So we can actually bring them into the picture, convince them enough, and when they are convinced enough, they go back to their own places to preach the gospel. Also, we can also make use of mass
Thank
media. We can make use of social media. There are some jingles. Then, as an health worker, mothers always have one reason or the other to visit health institutions, either for preventive purposes. Maybe they are bringing a child for immunization. They are coming for family planning. They are coming for infant welfare clinic or breastfeeding clinic. They are always coming for one thing or the other. During this our routine health talk, we can actually use like few minutes to talk about this pandemic, why people need to take care of their health and the like. All right.
Thank you very much. Before I ask you the last question, I think there is a common saying that prevention is better than cure, and the financial implication for prevention is far, far lesser than financial implication a disease condition in treatment. So meaning that we have to do all it takes so that we will not overwhelm the healthcare system. And I think I would like to use this medium again to inform the general public and especially our professional colleagues that even whatever we hear that is happening in the developed world, they still have the best of the healthcare system. Even though there are some lapses, there are some minor areas that needs to be improved upon. But I can inform you that what led to the increase in the death rate was because the hospital were highly overwhelmed. And as we all know that each of the hospital, each of the units has a number of capacity of patients it can attend to at a point in time. So when they are now having a lot of patients coming in at regular time, at the end of the day, there is no way, there is no magic, there is nothing that can be done that will reduce the death rate. But except that is why it is important for us at this point in time to work upon prevention, and prevention. So based on that, what advice do you have to the Nigerian health workers with the current situation? Because I know there are a lot of fear, there are a lot of anxiety, even with the issue of remuneration and every other thing. So what advice do you have to the healthcare workers?
Well, first and foremost, I want to salute all healthcare workers across the globe, across all nurses and healthcare workers across the globe. So, best, especially at this pandemic period. We are doing well, or we can still put in our best. No doubt, the work is enormous. But the WHO recommendation is a nurse should work with at most 4 patients. A nurse should care for at most 4 patients. And we have seen cases where a nurse is taking care of about 15 patients, 8 patients. The work is enormous. The manpower is inadequate. The working environment is not friendly enough to give in our best. But there's one thing I always tell people: let us always remember that the unique function of a nurse is just to assist an individual, either sick or well, to achieve those activities that can promote health and achieve those health and maintain their health, which he or she could have performed unaidedly if he has the knowledge, the will, and the strength to do so. So when we are caring for our patients, just be empathetic. Always put the patient in our shoe, put ourselves in their shoe. As if, what if I'm the patient? So putting ourselves in their shoe will help us to give our best, irrespective of all the challenges. Let us always put in our best. Let us always give in our best. Anybody can become a patient. Our family can become somebody's patient. We ourselves can also become somebody's patient. So we should always give in our best, be empathetic, and just try to maintain the standard at all times. And also, we're caring for others, we should not forget ourselves. Because it's only a healthy nurse that will be able to provide the necessary care to the patient. So if you are not healthy, you are not in a good state of health, you're not able to give out your best. So while caring for others, we should not neglect ourselves. Our PPE is also very important. We ensure whether the government provides it or not, the government are trying their best. But whether they provide it or not, we should always make sure that we adore our patient as a potential carrier of coronavirus. So we should always take care of ourselves and give in our best, be empathetic, have good interpersonal relationships with our patients, and maintain the standard at all times.
Thank you very much. Every nurse must take care of themselves so that they'll be able to provide the necessary care as required. On a last note, the advice to the general populace and the government so as to improve on the current situation.
Well, to the general public and to the government are trying their best. They're making use of so many media, so many news to convey the message to us on how to prevent, how to protect ourselves from this pandemic surge. So they are doing it. COVID-19, to the general public, COVID-19 is real. It is not a scam, and it has no respect for anybody, either the rich, the poor, the illiterate, the elites, the old, the poor, the healthcare workers, the non-essential workers. Even if you are not healthcare workers, COVID-19 does not have respect for anybody. And there is no vaccine for it, and the treatment is not yet, and there is no treatment at the moment. So all we have at hand now is prevention, and we should just continue to adhere to all those means by wearing our masks, practicing proper hand washing techniques, proper use of facial masks, face masks, avoid crowded areas, maintain social distancing when outside our homes. Then when we're coughing or sneezing, we should always cough or sneeze into our elbows. Then proper use of our hand sanitizers. So all these things we should just ensure we are there with them. And not forgetting my last word, the most important tool during this pandemic is citizens' compliance with preventive. The hand of all of us. Yes, it is in the hand of all of us. So the most important is citizen compliance with preventive measures. So let us comply with these protective measures, preventive measures, and be able to combat this pandemic together. Thank you for having me. I remain myself, AJISAFE Lateepha.
Thank you. Thank you very much, my guest. You've done a very wonderful justice to the topic. And on the last note, prevention, as you said. Once again, I would like to thank my guest, the nurse AJISAFE Lateepha Busari from Adeoyo Maternity Teaching Hospital, Ibadan, Oyo State of Nigeria, for coming on the show today. I'm so glad, and I'm very sure my audience have learned one or two important from this discussion this afternoon. And to my special viewers, I would like to thank you very much once again for joining me. I'll be coming up again with another interesting topic next time. Just stay tuned, and you'll be dished with various good information about what is happening globally about the COVID-19 pandemic. And for those of my viewers that for one reason or the other are not available at this moment, the full video of this discussion will be seen on the YouTube page, and is going to be shared via various platforms. Once again, as I said earlier, this take all of us together, bring all of us together, so that we are going to fight a common goal, which is the COVID-19 pandemic. Once again, my special guest, thanks for coming up on the show. And to all my esteemed viewers, thank you very much. Until I see you next time. Bye-bye.